Welcome to Shri Medical College. Today we will explore optometry and vision therapy, improving vision skills and function. As a species, humans rely on sight more than any other sense. Optometrists are extremely valuable members of society because of the important role they play in assessing and improving people's eyesight. The optometrist is an integral part of the healthcare team when it comes to the eyes. They are primarily in charge of outpatient treatment. Optometrists' roles in hospitals have expanded significantly since the profession's early days. In the 1980s, eyeglass prescriptions were often written by ophthalmologists, whereas clinical refraction was the primary responsibility of optometrists working in hospitals. It wasn't until the early 1990s that optometry colleges started offering degree programs that did more than just refract the eyes. The role has grown to involve a wide variety of tasks as it has extended into many fresh domains. Optometrists often refer to their work as vision therapy. Optometrists use the term vision therapy to describe any treatment aimed at improving or restoring a patient's visual acuity. An optometrist will monitor a patient while they engage in a variety of in-office and home-based reinforcement exercises over the course of several weeks to months. In this context, tools like lenses, training glasses, prisms, filters, patches, electronic targets, and balancing boards can be useful. Patients typically initially interact with optometrists when they visit a tertiary eye care center. An optometrist will check the patient's eyes with a slit lamp biomicroscope, measure intraocular pressure using an applanation tonometer, and evaluate their eye use before prescription dilation. Before moving on to examine the retina, this preliminary testing aids the ophthalmologist in making a diagnosis and selecting a course of treatment. Orthoptic vision therapy is a set of exercises commonly prescribed by optometrists with the purpose of improving visual acuity. These routines are carried out in the optometrist's office once each week for a number of months. Orthoptic eye exercises, orthoptics, are used by pediatric ophthalmologists and orthoptists to improve binocular function. Orthoptists are the doctors who specialize in the branch of medicine known as orthoptics, which is a branch of ophthalmology. To put it simply, orthoptists are eye specialists who focus on the treatment, management, and prevention of visual disorders. They coordinate school vision examinations, cataract screenings, diabetic retinopathy screenings, glaucoma screenings, tele-screenings, mobile eye surgery units, and more. Patients who are unable to leave their homes or hospitals would benefit greatly from the accessibility of high-quality eye care provided by optometrists at mobile eye clinics. Optometrists have the authority to conduct eye exams and dispense prescription eyewear on their own. If a dilated eye exam is unnecessary, the central retina can be inspected with an indirect or non-mydriatic ophthalmoscope. Eye doctors and other medical specialists are consulted when necessary. Vision therapy improves visual processing and perception using behavioral and perceptual methods. Eyewear for myopia treatment and prevention, nearsightedness. In some cases, orthoptic eye exercises recommended by pediatric ophthalmologists, orthoptists, and optometrists can alleviate the symptoms of convergence insufficiency. Vision therapy teaches the child how the brain controls the eyes, which improves his or her reading, studying, focusing, and attention. In order to enhance one's eyesight and visual processing speed, vision therapy makes use of a wide range of lenses, prisms, filters, and occluders to develop individualized exercises. Optometrists who have worked in practice for a while typically take part in teaching and mentoring newer professionals, both in clinical grand rounds and in the students' regular classes. They play an active role in the students' education. They also make valuable contributions as team members, helping to organize several CME events and scientific conferences. Vision therapy is used to retrain a child's visual system to more efficiently process visual information and improve the child's visual abilities. The primary goals of optometry are the diagnosis and treatment of eye diseases and the provision of services related to the assessment of visual acuity. Most eye diseases can be diagnosed by an eye doctor, and they can treat and provide medicine for most patients. In most cases, a patient's primary care physician or optometrist will have the most up-to-date information regarding the patient's glasses prescription. All of these topics, and more, are taught extensively during an optometrist's formal education. Optometrists are vital members of the healthcare team when it comes to the eyes. They spend much of their time interacting with customers and patients in places like hospitals and optical stores since they are experts at gauging and deciphering visual health. Therefore, everyone has great opportunities to promote the right vision solution, which is specific to each person's preferences and eye health. There is a specific set of knowledge and practices that one needs to acquire to be a successful optometrist. Learning optometry gives students the tools they need to develop these skills. A child's visual system can operate more efficiently with the help of vision therapy, which entails more than just eye exercises. Hospitals are increasingly turning to optometrists for pre- and post-operative treatment, as well as psychological counseling. With so many varieties of intraocular lenses available today, an optometrist may be the best person to explain each one to a patient. They might also be useful in informing people about the pros and cons of the therapies their eye doctors suggest. Patients with permanent vision loss rely on modern optometrists to assess their visual needs and provide low vision care and other therapy. Patients are given guidance on how to utilize these cutting-edge devices so that they can make the most of their limited vision in their daily lives. An optometrist with experience in pediatrics and vision development is the ideal person to examine and treat visual problems in children with additional impairments. B.VoC in Optometry and Ophthalmic Technology Eligibility Criteria. 12th class from any recognized board. Students, arts/commerce/science, of any age can apply. A minimum score of 50% in 12th class. Join Shri Medical College's Bachelor of Vocation and Master of Vocations in Optometry and Ophthalmic Technology and take the first step toward a successful career in hospitals. We are here to assist you in launching your medical career. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, Please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.